Today we had to demonstrate the intradermal injections for the college. Advantage, disadvantage, how to use it. We had to demonstrate all this here. So first of all, we have to administer the intradermal injection. There is a layer called derms. We administrated there. This is the layer between the epidermis and the subcutaneous muscles, which contains the less blood supply and a lot of immunoglobulin cells. For example, dendritic cells, immune cells, dendritic immune cells. So we administrated there, like BCG vaccines, Bacillus calmette-Guerin injections, where the countries having the lot rate of leprosy and the tuberculosis, they use the BCG vaccines. And tuberculin injections. Tuberculin injections are used to treat the tuberculosis. And as I say that immunoglobulin cells, so we use it for the allergy sensitive tests. And for the non-human primates like the apes, the monkeys, etc., we use for them the tuberculosis test. We use an intradermal injections at the upper eyelid at an angle of 20 to 20 at an angle of 10 to 15 degrees Celsius. Sorry, 20 to 15 degree. So there's the this is the intradermal injection. What are the advantages are we have to administer the small amount of medicine, because high immunoglobulins they react fastly. It causes less pain, and it's less cause less anxiety and less pain. These are the advantages. What are the disadvantages are like low blood supply, so the absorption pathways takes time. The absorption will take time, and it is the specific technique we had administered at the 10 to 15 degree angle. So we call it smart max technique, and it's a very difficult technique. Not everybody can use it. For example, non-professionals, non so at homes it's not used easily. So we have the alternatives. For example, we have the intradermal jet sprays, where the medicine is injected at the high pressure, and it does not cause the pain, and we do not have to take the angle 10 to 15 degrees. Second thing is we use the micro needles like wax id. So these are used also. So they get directly, we just put it into the muscles, and these are micro needles that reach to the uh, derm layer easily. So we don't have to use the Mortmax technique. So this is the intradermal injection. Now first of all, we had how to use it, how to demonstrate it. We have to first clean our hands with the help of soap, as we are doing usually every time. These are the 5 steps, like this, like this, like this, like this, thumbs, tips. Okay, first of all from the soap, and then from the alcohol. Okay, then from the alcohol we use the same 5 methods, like this, like this, like this, 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 and thumbs. And after that, cleaning our gloves, cleaning our hands, we have to wear the our gloves by 3 finger technique. Okay, first of all we had to put on the gloves, take on our gloves. We had to take the packet of the gloves and put it in the medical waste A. Okay, now we had to go for the syringe. We had to check its expiry date and all that and cut it. So we had to put its waste also in the medical waste A. So after that we need to take the medicine, and from where we had to take and just clean its cap with the cotton alcohol, and drop alcohol on the cotton and just clean it. And after that we had to put off the lid and just get the medicine. Okay, we use actually the 25 gig syringe and 25 gig needle, and administrated at the angle of 10 to 15 degree. Okay, after getting the medicine, just put up the ear from it. Okay, okay, now we had administrated by using a 2 finger technique. This is the dummy. This is where we had administrated at the 10 to 15 degree angle. So just 10 to 15 degree angle like this, and administrate it slowly and this, and get the needle out of it, and just drop it from the cotton using the alcohol, and just there will be the elevation type of our swelling. We have to use the cotton and just clean that surface, and put the cotton in the medical waste B. So This is how we administrate. Thank you.